All right, welcome back. Thank you for joining us today for the Talent Pipeline and Population Recovery Strategy Summit. We're very excited about this next session. Not only is it a perfect topic, but I think it's perfect for what we've all been dealing with the last year or so. But also it's brought to us by our major sponsor for today, which is Chenango Health Network. We are so thankful and so appreciative of them to be able to apply and receive the funding to help support this program. Because of them, we were able to make this entire day complimentary for absolutely everybody, and just to be able to give that to the community is so wonderful, and we appreciate your partnership. So this session, it's a group session. Hopefully everybody's coming back unless somebody took off for an early lunch, but this is called Workplace Wellness, and with us today we have Jamie Hagenbuch. She's the tobacco-free coordinator at Chenango Health Network. So just a couple of notes, if you can just keep your mic muted. For now, it's a small enough group. I think if you have questions or comments, if Jamie's comfortable with that, feel free to unmute yourself and ask, or use the chat window and we'll get questions answered. But without further ado, I will pass it off to Jamie.
Hello, everybody, and thank you for having us, Carrie. I'm pretty excited. This is something that is near and dear to my heart. I absolutely love talking about this. And as we talked about the pandemic and how mental health has affected us, it is the perfect topic to talk about workplace wellness. So I'm going to bring up my PowerPoint. As Carrie stated, I am Jamie Hagenbuch. I am with Chenango Health Network. I am a tobacco-free and health initiatives coordinator, along with a mental health first aid instructor. So we are able to provide lots of trainings, and we will go over that a little bit more towards the end. As Carrie stated, if you have any questions, feel free to ask them in the chat, or feel free to unmute and ask me when I'm at that point. I might not have the complete answer, but I will definitely try to get you the best answer possible. So we're going to go over our agenda today will be the introduction to mental health and wellness, an overlook at workplace wellness health strategies, and we will talk about how your business can go tobacco-free and how that helps with the wellness of your organization, along with how can you get involved, whether it be around workplace wellness and the tobacco-free initiative. So what is mental health? Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. And it also helps to determine how we handle stress, stress related to others, and how we make choices. Why should we care about mental health in the workplace? So why talking openly about mental health is important in the workplace? It can help your staff to feel more validated, help them to feel more reassured. As problems arise, they feel more confident to be able to go and speak about them openly without judgment. It could lead to less time off due to mental health issues. And if you look after your employees' well-being, then levels of engagement will rise, and so will the staff morale, loyalty, innovation, productivity, and profits. So I'm gonna do a little pop quiz. Feel free to unmute if you have what you think is the answer. What are the chances you will develop a diagnosable mental health condition at some point in your life? Anybody have an answer to that, or possible answer?
75%.
That's a good. Anyone else?
50?
It is. It's 50. So it is 50% likely that you will have a diagnosable mental health condition. And like I said, that's diagnosable. So that's not saying that you won't have maybe a time in your life when you experience a time of depression or anxiety. This is just diagnosable through your physician. In any given year, how many work days are lost as a result of symptoms of mental health disorders?
10. 20?
How many did you say, Kim?
20?
It is actually 217 million in any given year of how many work days are lost. That's just not as you as an employee, it's as everybody as a combined. Good answers though. In a nation survey, how many employees between the ages of 15 and 54 have reported they have experienced a mental health disorder in the previous month? Anyone? It is 1 in 5 people. That's a lot. So that's, I don't know how many are on the call because I can't see everyone right now, but that would probably be, if there's 20 of us, you know, that's going to be about 4 of us. So to me, that's real, that's impactful. So we're going to go over a little bit about anxiety and depression, some of the statistics. Nearly 1 in 5 adults experience anxiety disorder or a major depressive disorder each year in the US. These statistics might have changed since the pandemic. We don't have new research yet, but that's still quite substantial for, like I said, it would be 4 of us if there was 20 in this call. Comorbidity is common for individuals with anxiety disorder. Depression results in 44 billion in lost productivity and performance annually. So when we're talking about workplace wellness, 44 billion lost in productivity and performance annually. That's a lot of money lost. In a 3-month period, employees who have experienced depression miss on average of nearly 5 work days and over 11 days of reduced productivity within your business. And in the last 12 months, 1 out of 3 employees experienced at least 1 panic attack. So these are all things that, you know, I think it's been more of a, more in the forefront since the pandemic. And as society becomes to talk about and normalizing mental health. But these are some really good statistics to throw out there. And then we go on to substance use. As we know, that goes hand in hand with mental health. So I'll just read a couple of them off. 1 in 4 workers reported drinking at least once during the work day in the past year. 500 million work days were lost due to excessive or heavy alcohol use. And 1 out of 10 victims in workplace fatalities had been drinking. So that's pretty high statistics when we're talking about our workplace and substance use within the workplace.
Jamie, I don't know if you saw a question of what does comorbidity mean?
Like a combined death. So it could be with mental health, behavioral health, it could be with, you know, 2 different types of diagnoses. So it could be from the anxiety and depression. It could be from the medication. It could be a result of side effects, such like that.
Thank you. And thanks, Kendall, for also chiming in.
The bottom line is that as an employer, you can't afford to ignore mental health. Investing in mental health for your employees is central to taking care of your biggest asset, which is your workforce. Why workplace wellness matters. So as we talk about mental and emotional health of our employees in the workplace, it affects everyone involved, right from directors to entry-level workers and their families. And then when we talk about why is it good for business, these are just a few reasons why it's good for businesses. Studies have found that mentally healthy workforce is linked to happier employees, lower medical costs, higher productivity, lower sick pay costs, accident reductions, lower absenteeism, lower, I lost my train of thinking, higher performance. So there's all of these types of benefits to why investing in workplace wellness is important. So then we talk about the disability impact, and that is the disability of the United States, the disability within your workplace. 1/3 of all illness related disability in this country is caused by mental illness and substance abuse. Mental health conditions cause more work loss and more work impairment than any other chronic disease. And the World Health Organization predicts depression will cause more days of work loss and impairment than any other illness. I'm sure that this has been updated for the World Health Organization, but I wasn't able to find more statistics of recent ones. Sorry, froze for a minute. And now we'll talk a little bit about workplace wellness implementation, how you can start to implement this within your workplace. It can seem overwhelming if you don't already have a workplace wellness program. One of the first ways to do that is to start evaluating your workplace wellness program. If you already have one existing, this can be used in any type of organization, large or small. It is meant to be flexible. So any implementation of a workplace wellness program is really based on the organization that you're looking to implement it into. So evaluating your current program is essential. So there are various activities and resources that employers could incorporate into their policies and procedures that are already exist, or you can start from scratch. For many employers, knowing where to start, it can be challenging. It can be overwhelming. So some key items that can be included are items such as evaluating your workplace wellness program, as I just stated already, an internal culture audit your managers, audit your employees, see what's working and see what's not working. Develop aspects of your organization's culture that may be interfering with much needed mental health offerings. I saw we had a question come up. Was that, were you able to see that, Carrie?
I think that we already did that one.
Huh?
We already did that.
Oh, okay. All right. Mine must have still be blinking, sorry. And assessing the employee's needs. Ensure that the addition of programs that matter most. First steps would be assessing the employee's needs, as I just stated. Administer a survey. We have some sample surveys that if somebody had some questions, I could provide some that we already had some questions on. You could do it through SurveyMonkey. There's other options if you're a larger employer. And if you have any questions, we do have some resources I could help you with. But finding out where the gaps lie, what they could benefit from, and what your employees feel that they need. That is so huge. They can suggest activities that will work best within the organization, and then you can start to implement those. It doesn't have to be something that you do at a large scale, and you don't have to do it all at once, but little by little. And then most employers have what's called the employee assistance programs, the EAPs. If you do already currently, it is a great idea to reach out to your EAP program, see what exists, what doesn't, what maybe there's gaps. Your employees may not even know that this exists. That's something that we found with working with employers and such, is that they may not know that it's open up to their employees, their families, and that there are, that EAP offers supports around stress management, family counseling, and substance abuse counseling, grief counseling, and even legal and financial counseling. So always reach out to your EAP if you're not familiar with what they have to offer. That's a great way to start, is being able to push that out to the employees so they are aware that it exists, what the services are, and they can find out how to utilize that. And then our stigmatizing language. Our language itself has become a barrier to our wellness. So there's such things that you can hang around your organization. And like I said, we do have some sample things that we could send you, some sample posters that are around what to say, what not to say, you know, using your words and how they matter. And you can probably find some of those right on the website or right on the internet as well. But there's a lot of different things to remind people that instead of saying somebody's crazy or psycho or insane, to use language such as, this person is living with maybe depression, maybe anxiety, and really rethinking about how we talk and use our language. And then suggested mental health trainings for managers. It's important to know that when our managers go through training, sometimes they're not going through mental health challenges or mental health training specifically on how to deal with employees that may be experiencing mental health. So it is important for managers, and not every manager, like I said, has the skills to have a conversation with somebody who is dealing with a potential mental health challenge. And this is where the training comes in. So first, take an inventory of what are the current trainings that the managers have, or maybe that you offer within your organization, and then identify gaps as they relate to mental health related content, and get some training opportunities on the calendar for the current onboarding of managers. Some suggested trainings for managers include our mental health first aid trainings, sensitivity training, suicide prevention, suicide postvention, substance use, cultural competency. Those are just a few that I'm aware of, but there's so many trainings out there that could be beneficial to your organization and potentially free as well. Whether the training is online or in person, mental health trainings are important and are good for management practices to foster a healthy workplace. Self-care, there are tons of self-care resources out there. So we have Encouraging Self-Care and 7 Steps to Self-Care at Work. I have some of those if you would like some of that information. Self-care is important, and research shows that strategic renewal will boost productivity. In our work days that are filled with expectations of multitasking and increased emphasis on efficiency and productivity, studies have proven that including daytime workouts, longer sleep hours, more frequent holidays have shown to boost productivity, performance, and health. Some ideas also for self-care and encouraging self-care at work is encouraging your staff to get up and take a lunch, maybe encouraging lunch breaks, 15-minute breaks, maybe a walking meeting, technology breaks, vacation, personal days, internal communications, quiet zone, and share inspirational content. 7 steps to self-care can include things such as develop a 2 to 3 item top priority for the list day to tackle instead of looking at that long list of to-dos that you need to do. Make time for intermittent self-care breaks. Create a healthy workspace for yourself, and drink lots of water and eat healthy. Mental wellness activities, promoting workplace wellness can be challenging and goes beyond weekly newsletter mention. Mental health friendly activities will recharge staff, bring greater productivity, lower and maintain health insurance costs, and improve retention. Some of those activities could be a lunch and learn, yoga, meditation, wellness bingo, and wellness library. Those are just to mention a few. Ways to take care of yourself during a stressful time. I'm just going to put them up there so that you guys can read them. Many people are working from home and or are isolated from home, so keep a daily routine. You can see a couple of these on here. It's normal to feel anxiety and stress. Everyone reacts differently. These are just a few. Try, and even if you're working from home, take those normal scheduled lunch breaks just like you would, and maybe have a workspace. Ways to take care of yourself during stressful times. These are, like I said, just a few I wanted to throw in here. Maintain a healthy lifestyle, eat and sleep, exercise, get outside. Now that it's getting warmer, hopefully in New York State, we will be able to get outside and stay informed of accurate accurate information, but do not focus too much on all the media as it can become overwhelming, and know the facts. Those are just a few to mention. Things to be aware of. These are always, if we want to stay consistent in making sure that our mental health is good, change in sleep patterns, increase in fear or worry, trouble concentrating, loss of energy. Always want to pay attention to that. When mental health issues exist, it is important to take care of yourself. So make sure that you're paying attention to what you need. Isolation and loneliness can lead to depression and increased symptoms of your depression, which we've kind of went through one of the most isolated times with the pandemic. So this is super important to remember. Utilize your supports and try to manage your stress so that you can keep your stress levels low. Mental and emotional wellness. Like I said, these are just some more to remember. Wellness is more than just physical health. It also includes mental, emotional well-being. Being emotionally healthy does not mean you are happy all the time. It means that you are aware of your emotions. You can deal with them, whether they are positive or stress triggered. Emotionally healthy people still feel stress, anger, and sadness, but they know how to deal with and manage their stress triggered feelings. So those are all just a few on a mental and emotional health. I know I'm running behind, so sorry if I'm going a little bit too fast, guys. Let me know if I am speeding through. Self-care isn't complementary or alternative. It's fundamental for our health. It's a constant repetitive of many tiny habits that together can really make an impact on our life. So make sure that you're indulging in self-care, whether it's reading a book, taking a walk, any of those. The power of breath. I say this all the time. You can go back and look at the PowerPoint if you want to practice this. I do this as I'm booting up my computer in the morning, simply sitting at my desk, and nobody has any idea I'm doing it. So it's a great way to relax. Creating calm and ease at work. These are just some things that you can do when you're at the workplace. Whether it's at home or at work. Start your day with a mindful minute before you turn on your computer. Take a moment to ground yourself. That's where the breathing comes in. Tune into your thoughts. Notice as you sit there and relax any areas of tightness and tension, and just breathe. Here are some community resources that we have to offer. These are not everything, not all inclusive. These are just some of them that you can take advantage of if you are finding yourself needing some mental health support. Now I'm going to go in really quickly, because I know I am running late, into tobacco and how that can help for wellness within your business. So Go Tobacco. Why should we do it? What should we do? And how should we do it? So I'm going to go over those questions. So employee wellness, as we were just stating, you want to eliminate that exposure to secondhand smoke. Cigarette smoking remains a leading preventable cause of death in the United States. It is substantial evidence linking exposure to secondhand smoke to a wide range of serious and life-threatening impacts, such as heart disease, cancer, asthma, bronchitis. There is no safe level of exposure to secondhand smoke. So having a tobacco-free outdoors grounds policy in your workplace is one of the most effective and lasting approaches to reducing employee health or employees' risk. And of course, when we talk about the financial savings, lower absenteeism, increased productivity, may reduce direct healthcare costs, and lower maintenance costs. Employees who smoke cost an employer on average about $6,000 more each year than a non-smoking employee, which I found very, very impactful. Improve your curb appeal. There's less litter, less loitering, demonstrates commitment to employee health and wellness and safety, and demonstrates respect for the environment. These are old statistics. As I said, we didn't have any new ones, so I'm sure this might have gone up, and we're going to be doing a survey community-wide, statewide. So be on the lookout for that. If you get a call, we would love for you to participate in the new survey. It's going to include things around vaping, tobacco-free outdoors, tobacco-free housing, and such like that. These were the current statistics that we were able to find. We have many organizations globally and in Chenango County, such as Chobani, Raymond Corp, Unison, Nina's, The Stadium, The Wild Owl, and that's just to mention a few that have chose to go tobacco-free with us and have tobacco-free grounds to make it a more appealing and healthy workplace. A comprehensive tobacco-free policy is something that I can provide for you and help you every step of the way. We can get you free signs, create the policy and implement that for you. It prohibits the use of all forms of tobacco, including vapes and all of that, and applies to all owned and leased buildings, grounds, companies, private vehicles, includes compliance protocols, promotes cessation. So it's a great thing to do. This is kind of the recommended plan. Develop the, convene a work group in the larger businesses, develop a policy, identify cessation resources, develop and implement communications plan to your employees and to business customers, and monitor and evaluate. The framework for success. Basically, this is a this and not this. So you want to be able to create an environment that protects your staff and your business customers from secondhand smoke and exposure, and in which smokers may be more motivated to quit, less than focusing on getting individuals to quit smoking. Develop a positive messaging promoting health of the entire workplace, and foster compliance with positive messaging and respect for smokers and non-smokers and the environment, and evaluate success based on the degree of the organization and the business buy-in and support, and maximize ability of cessation resources for those who want to quit, and use a tobacco-free policy as a springboard for celebrating health and wellness. And what can the zone do for you, which is basically myself and our team, is participate in your tobacco-free work group, sample policies and lunch outreach or employee outreach materials, policy review, help in planning the policy kickoff event, and no cost signage, which you can kind of see the sign on the right-hand side of your screen, and we can customize that to put your logo and make it however you would like. That is at no cost to you, and promote cessation. And with 1 minute to spare, does anybody have any quick questions? If you have any questions, because I did go through that a little quick, if you have any questions, feel free to contact me. I can help you. I can create the policy. And like I said, we can create the signage. It's completely free to all businesses. And we are looking to grow and see how many businesses in Chenango County would pledge.
Thank you very much, Jamie. That was great information. That's all really important. The workplace wellness is something I think everybody needs to think about and find ways to implement. Tobacco-free is something that we can do as a community to help encourage, again, it goes back to comfort level, encouraging employees, encouraging the workforce. So thank you very much. I know we're just getting into the half-hour break for lunch, but let's see. Somebody asked, do you do presentations for companies to give to their employees, such as Lunch and Learn?
Yes, we can absolutely do that. Yep. And we also do presentations at the schools, and we also have a reality check program. So if anybody in Chenango County has youth that would like to be involved in that, we can also help with that as well.
Well, in the agenda, you did have a link to Jamie's presentation, so you'll have her contact information as well. And again, this will be posted on our YouTube channel later, so you could also share this presentation internally or with your staff. But thank you so much, Jamie. I really appreciate the time and the great energy, and thank you so much. We will take a break for lunch now. Hopefully you're utilizing a local restaurateur for your lunch. I believe we got Angela, so I'm very excited about that. So we will be back at 12:30. We'll be back at 12:30. Our next session is another breakout block. The future candidate and talent sourcing beyond the pandemic is your first choice, and the second choice is where is it? Oh, transportation. Barrier to employment transportation from Rural Health Network. So we'll be back in a little bit. Thank you so much.
Thank you.